We are coming up on the holidays, and many traditional favorite foods like this, for example, will be difficult for a lot of people. Like many of us, our next guest had a lifetime of less than ideal experiences with the dentist. After many years of patchwork, she could no longer eat regular meals and lost part of her identity. Patricia finally found life-changing relief when she met Dr. Raouf Hanna at the Hanna Dental Implant Center. Dr. Hanna gave her back the confidence to light up every room she walks into. Patricia, you look familiar. You were on a show of mine several years ago. Your daughter wrote it in, and the topic was Make My Mama Hot.
Yes.
and as we know, that is a maintenance issue, right? Because we always got to keep chasing, upgrading things, and our teeth are no different, Dr. Hanna. Even when we do the right things, things can happen with our teeth.
Oh yeah, you can have genetic factors. You can have health factors like diabetes. Several issues can cause you to have either gum disease or increased caries risk, or both, accidents, trauma.
Yeah. And it used to be, you know, what you did with that was, when you have missing teeth, was dentures and bridges and things like that. But with implants, this has been the big game changer. You've placed over 22,000 implants over the years, and this is your specialty. So you're double board certified. I just want to say it matters who you go to. Explain to us what an implant actually is. And I think sometimes people think we're implanting every tooth, and that's not the case.
No, what we do is, an implant is basically an anchor. It's titanium. It's what the body and the bone fuse to it organically, like biologically. It's not a foreign object, and it's placed strategically in certain, and probably like the corners.
Yeah.
So think about it as 4 corners, and they're holding a full set of teeth permanently. So you got back your function, your confidence, your smile, and health.
Yeah, Patricia, you remember going to the dentist a lot as a kid. A lot of us remember doing that too, but it was for your cleaning. You went to the treasure box and you left. For you, it was beyond that. You always had a battle with your teeth.
Yes, I did. I remember as a child, we went to the dentist, and it started from there. So when I got like in my teenage years, and then I started having more cavities, and then in my older years, I went to many dentist office, and nothing helped.
Yeah, yeah. You just kept paying money after money
Yes.
after money
Yes.
for temporary fixes. How did that impact your self-esteem?
I didn't have no self-esteem at all. I didn't want to smile. And I never noticed that every time I smile, I would cover my mouth.
Yeah.
And I still do that today.
Yeah, it's hard with those habits, right?
Yeah.
It takes a minute to realize that you can smile. Also takes a minute to realize that you can eat the foods that you like to eat.
Yes.
In a minute, I want to find out the first thing you want to sink your teeth into. But your daughter, who's always been in your corner, was able to help find Dr. Hanna. So Dr. Hanna, what was going on in her mouth, and how did you fix that?
Well, she had years of temporary fixes, so several missing teeth. The bite was not coming together properly or correctly. We had infections, like a couple of abscesses. So solution was to just start over, build everything back up, and it's a one-day procedure, same day, under sedation. You're asleep, you wake up, and the teeth are in and done, and you start following some post-op instructions, and then you have permanent teeth.
Yeah, you said something that was music to the ears of a lot of people, and that is one day.
Yes.
It used to be you go back and you wait months or whatever, but part of that one day is because technology has changed and you have the latest technology, but also you have a lab inside of your office.
Yes, we have the lab that allows me to make teeth within an hour, insert them. We use digital scanners and digital milling machines, so everything is super accurate. Like when I compare what we do today to what I did 15 years ago, is just nothing is similar.
Yeah.
We have everything changed.
A lot of people will put something off too because they're afraid of the pain, because they think about, well, if I go to the dentist, I've had this, I've had that, I have that. Everyone who's had those implants, including my mom, and I think my mom was 94 when she had her implants done with you. She was like, she was done, and I went to go pick her up, and she's like, "Will you like my smile?" I don't know what you gave her, but she was. but Patricia, for somebody who's feeling like the pain part, they don't want to go through that. They've gone through pain with their teeth before. This is it's a breeze, isn't it?
Yes, it is.
Well, I can tell you a secret. So what we've started doing 2-3 years ago, we have a pain blocking injection that we give after the surgery, and it stays for 5 days.
Oh, wow.
So your healing is as comfortable as can be.
Yeah.
And this has been a game changer for us, because like when we give this injection, I know the patients are going to be comfortable.
Yeah, your recovery was good.
It was a blast.
It was a blast.
Yes. No pain, Deborah, no pain. And when I wanted to talk, I had to, my husband gave me a pad to write on. And he said, that's the only time you are silent.
But you talk now, and you probably
now.
couldn't stop. What was it feeling like for you the first moment you looked in the mirror?
Oh my gosh, I couldn't believe it. When they did the x-rays or the pictures in the office, and I went in to talk to Dr. Hanna, I couldn't believe how my mouth looked just so, I was so beautiful.
Your daughter's mama was hot again. Okay, I would ask you a question in a second about your husband, and that's your husband over there, right? Let's bring him over here and get him a microphone. But what was the first thing you wanted to sink your teeth into? You talked about you had to get used to smiling again. You also had to get used to what you could eat again, right?
Yes. Hamburger.
Come on over here, sir, and you sit down, because there's something that you told our producer that I thought was amazing. And you said that she smiles without smiling now.
When she talks, she's smiling.
Yeah.
Every time she's talking, she's smiling.
Yeah.
And for me, she lights up a room now.
Yeah. And what is it like as a spouse to watch her go through all this?
All I can say is I try to encourage her.
Yeah.
I try to encourage her to do it. I mean, to go through the process.
Yeah.
Trust the process is what I always
And
tell
what
her.
change have you seen in her now?
She's more outgoing. When we go places, I'll be telling her, look at these people looking at you. And she get really positive responses everywhere she go.
All right. Another thing that stops a lot of people, Dr. Hanna, is the affordability. Obviously, what you get from this, your self-esteem and being able to improve your health by eating a wider range of foods, that's priceless. But the thing is, y'all realize that, and you will work with people.
Yes, we have several options, several treatment. We can phase your treatment, or we can also help you with financing with our partners. Like, we try to do our best.
Yeah. Thank you so much, and good to see you again.
Thank you, Deborah.
Hanna Dental Implant Center has a special offer for Great Day viewers. Get 15% off a future appointment when you call today, but you must mention Great Day Houston to get this discount. If cost is a concern, the staff at Hanna Dental is happy to work with you. To schedule an appointment, call now, 855-Dr. That works out to be 855-374-2662. Again, 855-374-2662. For more information, you can also log on to hannadentalimplants.com.